Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Gavin Courtney.
And thank you for joining us this morning, where we had showers of blessings in
we did.
Belize City. That was a wonderful sound to wake up to.
Yeah.
Right? But of course.
Yeah, and we're going to hear all about that right now. And we have Crystal Rosales on the line. Good morning, Crystal.
Good morning.
All right, so we had some rain last night. Finally, we're getting in a bit of showers after a pretty long dry spell.
Yes.
All right, so can you tell us a little bit more about our general situation?
Moist and unstable conditions prevail over the country.
Yep. And over the next 24 hours, what are we going to be looking at?
Mostly cloudy skies with some showers occurring over most places. Then thunderstorms will affect mostly northern and central areas today, then mainly the south and coast tonight.
Okay, and what about the winds?
Winds will be from the east to northeast at 10 to 15 knots, and then the sea conditions will be light chop.
Okay, and so we were looking at cloudy skies, but what are the temperatures like for today?
The high temperatures today would be 84 along the coast, 90 inland, and 80 in the Maya Mountains.
Okay, and our low temperatures?
Tonight will be 80 along the coast, 72 inland, and 68 in the hills.
Okay, and for the general outlook, what are we going to look at for the next couple of days going into the weekend?
Well, moist and unstable conditions going into the weekend is going to be somewhat maintained, but for the next 48 hours, it's going to be generally cloudy with a few showers and thunderstorms.
Okay.
Again, mainly over the north and central areas Friday, and then the activity will become isolated on Friday night and mostly over the south.
Okay, so we're looking at a lot more showers.
Yes.
All right. So not the weekend to go, well, it would not be the weekend to go outside anyways, but so you should be happy to stay in your homes. But thank you very much for that update, Crystal.
You're welcome.
And I hope you have a great day.
And you guys as well.
Bye.
All right, bye.
Bye.
Woo!
Yep, there you have it, guys.
Yeah, cloudy and some showers. And not only that, those are a lot lower temperatures than we've been seeing for a while.
That's very true.
So there's actually no heat advisory today for you in the inland areas. Do soak it up. If the plants need some rain, put it out, whatever it is. We are sure to get a few showers somewhere in the country today. Like I said, it's very welcome. It's nice to wake up and smell that rain.
Oh yeah, for sure. And then you know me, I don't like the heat. So I'm glad to hear when there's...
Living in the wrong country.
I know. But I mean, that's one good thing. One other good thing that rain brings, you got a little bit of a drop in the temperature, so it's a bit cooler, especially if you're in your house all day or, if you don't have, AC. And any sort of a dip in the temperatures is welcome.
That's right. Okay, but we're going to keep things moving now, and it's time for Our Eye Opener. A little bit of motivation to get us started for today. And Our Eye Opener is taken from dailyom.com, and it goes like this. Sometimes the motivation to help others may be an extension of a deep desire to heal a wounded part of ourselves. Some people seem called to help others, often from very early on in their childhood, responding to the needs of family members, strangers, or animals with a selflessness that is impressive. Often, these people appear to have very few needs of their own, and the focus on their lives is on rescuing, helping, and healing others. While there are a few people who are truly able to sustain this completely giving lifestyle, the vast majority has needs that lie beneath the surface, unmet and often unseen. For any number of reasons, they're unable to give themselves the love they need, and so they give it to others. This does not mean that they're not meant to be helping others, but it does mean that they would do well to turn some of that helping energy within. Help comes when we allow ourselves to admit we need it, acknowledging our humanity and our wholeness by acknowledging our pain. The understanding we gain in the process will naturally inform and inspire our ability to help those in need to do the same.
That's a pretty powerful message. I think we observe people like this all the time, and as the thing started, and I was hearing a lot of the beginning part talking about people who seem so selfless and giving, and it's almost to the point where like they don't have time for themselves.
Yeah.
Automatically, my mind went, and probably because Mother's Day is coming up of our moms, because that's that person, or at least the first person in so many of our lives. And we even hear it sometimes. You see it on TV or whatever, and people are talking about, mom never makes time for herself because she's too busy taking care of anybody else, and that applies to mothers, grandmothers, and so many of us. I mean, of course, we do have male figures who do the same thing, but it's a natural association that a lot of people make, and it is really important, the message that is being spread, in that time has to be made for yourself, not only just to feel better, but also to look inwards, to see what I lost my train of thought there. To look inwards, to really assess what your needs are. That's where I was going. So,
well, I think two things come to mind for me. One is that you're absolutely right. I think most mothers are completely we always distinguish them as the ones who are the helpers in the family. Mm-hmm. They take on a lot. And more and more I think of mothers right now who are at home, working from home, taking care of the kids, executing domestic duties, and still being everything to everyone. And it can be overwhelming. And I think that we don't necessarily acknowledge that, one, it's unfair. Mm-hmm. But two, that while I think women sometimes just take this on because this is part of what we have been made to understand is our maternal role and function, it doesn't mean that sometimes you don't ask them if they need some help. Mm-hmm. So I think of it two ways. I think of people who need to ask for help sometimes, and that we also need to acknowledge that when you see someone who's so giving, that we have to step in and ask them if they need help. Yeah, they're not always quite there to be the ones to reach out, and that's the key thing. There's a lot of lessons that we're learning, especially at this time, and I think a part of it is just the shared humanity that we have. And so when you see people who seem to be the strongest and the most willing to give and listen and participate and share advice, it's always a good idea to kind of just turn it back around and say, and how are you? What do you need? What are you experiencing? What are you feeling? Because most likely they haven't been asked that by anyone, and that they are also trying to avoid filling their own gaps as well.
It's really interesting that you say that, because it got me thinking, especially in this time, about our frontline workers. In a situation like this, and what we're going through in the world right now, it seems that people who are really stepping up to the plate are doctors, nurses, healthcare professionals, other people who are providing frontline service. It seems that they really are giving a lot of themselves. Yes, there's a lot of people demonstrating gratitude and trying to give gestures, but we also, I can't imagine what that's like, to like really be putting myself out there every single day on the front line, risking, depending on the situation, especially for medical personnel, you're risking your health as well.
And the health of your family.
Yes, exactly. Yeah. So it is very important to show that appreciation and ask what are their needs. And I'm like, so I'm always really encouraged when I see, videos of people donating things, whether it's food, whether it's equipment, whether it's, gift certificates, or just, gifts to just make them feel better, because they're people too, and they want nice things and things, even like I saw.
Or just a kind gesture.
Yeah,
like
something
sometimes
kind.
just hearing thank you goes a long way, or something that shows appreciation. I'm glad you said that, because we can remind people that it is Nurses Week. Yesterday we had a really great conversation with a group of nurses, and I reflect on certain parts of it where the nurse talks about just kind of like the heart palpitations, leaving your house, leaving your family behind, knowing that when you come home, what you're going to expose yourself to, what you may potentially bring home, and just that nagging fear, which is so natural, that they have when they go out to just execute their work. And I think it's so powerful because they still show up.
Yeah.
And they still go, and they still continue to execute their duties to the best that they can under the circumstances
For
that
sure.
they have.
Yeah, and then I also did want to touch a little bit on the sort of the second half of the eye opener, because it also can apply as well in either of the situations that we've been discussing. Whereby a lot of these people who do these things and are so giving and seem so selfless, a lot of the times they're often reluctant to ask for help, because they feel like it's their role, or it's their job or whatever. Yeah. So on the flip side, if you're one of those people, don't be afraid. Don't be afraid to make your needs known, and try to take time for yourself, even if it's a moment out of the day just to practice some mindfulness. Even if perhaps you're working all day, or you have a family to take care of that you can't really leave, but if you can take even 5 minutes to just sit down in a quiet place, and during those 5 minutes, you could either take it to center yourself. You're saying, all right, what do I really need right now? What would make me happy right now? And then you can either find a way to do that, or ask somebody to help you. Say, you know what? I've been having a really hard day. I would appreciate if you took care of dinner tonight, so I don't have to cook, or I don't have to order, or whatever. Or something very simple like that, and you realize that those things, little things like that, make the world of difference, and put you in a better position to even continue helping yourself. Helping others, sorry. But helping yourself is really important, which is really the point I wanted to make, and the point of what I was getting the most from the second part of the eye opener.
Yeah. So, just reach out. I think reach out if you're the one that needs help, and reach out to those who you've noticed have not been asking. Yeah. Like I said, it's just a time where while we may not have physical connections with people, it's a good time to at least build some sort of connection, and that happens with just genuine thought and consideration, right? We got to get moving into our show for today, and today we're having a really interesting conversation. So we are just a few months in, we're actually 2 months for us in this entire I think world uprooting event for us. And so there's been some development along the way. While we are over 2 weeks with no new cases, there is some development taking place in how you can access information for new tests. And so we're going to be finding out about that. It's actually an app that you get for your phone, and it'll help you sort through your symptoms. It's being made for Belizeans, and we're going to get all the details about that in our COVID-19 update for today.
Yep. And for our second conversation, we know that businesses across the board in the country have taken a huge hit because of all of that has come out of the COVID-19 pandemic. We know that there are businesses, large and small, that have been negatively affected, employees, everything like that. So we are going to actually be learning some strategies for managing these changing times from Charlotte Lopez, and she's going to teach us all about how businesses can cope and what's the road to recovery look like.
That's right. And let us not forget, you introduced it earlier on, life is continuing to move by, and Mother's Day is approaching. And, I think all of us are just like, okay, so how do we celebrate Mother's Day? Well, today we're going to help with some of the gift options. We're actually going to be making some art today, some gifts that you can give to your mom. And that's actually going to be with the Stationery House. We're going to make some personalized refrigerator magnets. And We're also going to be talking about the online shopping available at Pink Boutique for Mom.
Yep. And of course, we've got something for the kids. We have our Kids Time segment again, so get them around the TV. And today, Dr. Bannock is going to be teaching them all about ecosystems, something we've got a lot of different ones in Belize. So that should be really interesting.
All right. So that's what we have lined up for this morning. We are going to take a break, but before we do,
Yep.
Birthday shout out.
Yep. And today we are wishing a very, very happy birthday to Misha McDougall. So from all of us at Open Your Eyes and Channel 5, we hope that you have a great day, Misha, and enjoy it and many more.
All right. And with that, we'll take that break and we'll be back with the COVID-19 update. Please stay tuned.
Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally.
And we're back. We're here jumping right into our first conversation, and we're going to learn all about the new COVID-19 mobile app. Here to talk to us about that are Mark Noble, who is the manager of systems development and the data processing department of the Statistical Institute of Belize. And we also have Michael Singh, who is the advisor for e-government and digital transformation with the Office of the Prime Minister. Good morning, gentlemen, and thanks for joining us.
Hi, good morning. Good morning, Gavin.
Hey, good morning. Thanks for having us.
All right, so we're talking about something really exciting today and really interesting, the COVID-19 mobile app. So perhaps you can start by just giving us a brief description of what the app is and what it does.
Actually, if you don't mind, I'd like to kind of start a larger overview as to what the technology response that government has been doing
Sure.
For COVID-19. So, of course, this thing came upon us very sudden, and we had to react very quickly. Belize doesn't have the resources like larger countries to be able to respond medically at a large scale. So it means that we had to take a different approach, not only to go ahead and prepare our medical system, but also to prepare ourselves for tracking and tracing at the early stage. The fortunate thing is that we started with very few infections, which gave us a little bit of breathing room to be able to do tracking and tracing. And I think it was very public, the work that Dr. Manzanero and his team were doing in terms of looking at people that were infected. Of course, we found that the majority of our infections were imported. So we were able to track and trace that circle around those infections. So there needed to be an IT system to support that so that we can analyze the data very quickly. So the SIB was brought in through the Ministry of Health to assist with building an infrastructure, a suite of software, not only to help with the tracking and tracing by field officers, but also to assist with the call center calls that came in, because of course, anybody that felt that they had a symptom would be calling the MOH Care hotline. So we had to be able to take that data, look at it very quickly, and to be able to put it into a usable format.
Yes.
Mark will talk a little bit more about the actual technology, but the policy and the principle we had is that we had to bring everything together very quickly to be able to look at information, to be able to analyze, and to be able to plan so that the resources we have were deployed in the best possible way. What that meant is that teams that would be going out to assess potential cases of COVID-19 had to be given the tools to capture information and to send that information very quickly back to headquarters and to put it into a mapping system that allowed us to look at all facets of the data and to be able to determine where the risk areas are and to be able to put testing information to make sure that the people that were being assessed and that were connected to other people being assessed, so that this wider map could be created of the entire country to see where the risk areas are and where the connections between cases might be. So that sort of evolved, and Mark's team at SIB, along with Jehan Chavaria, who is the economist at Health that deals with the statistics side of it. They came up with this system that we will describe today that brought all this information together into one pool. We also felt that there was a need for us to get out to a broader spectrum of potential risk areas where the public themselves can come in and assist us with self-screening. And that's what the app is all about. So the app is really a part of a larger IT effort that will help us to get to the next phase of COVID management. Now we're fortunate to hear that we have no active cases. Now what that means is that we now have a reprieve, that we can step back, start looking at our entire population and start preparing for the eventuality that there will be visitors, for the eventuality that schools will have to open, for the eventuality that there will be larger gatherings. But we need to be able to assess the health of the people visiting, the health of the people in schools, and the health of the general population as they move towards a more open economy where people will have to gather. We're talking about people and transport systems.
Yeah.
So we have to be able to have those tools. And that's what this suite of software is, where the app that we're launching is just the voluntary citizen side of it. There are so many other pieces where they all go into a common database. So if that sort of gives you the overall description, I wanted to set the stage with that so that you understand that this is not just an app that we're putting out there. It's actually a part of a greater solution.
Yeah, and it actually goes broader than that, and I think it's a good time to be able to kind of look at just the digital transformation that Belize has been forced into within, 6 to 8 weeks. I think just about every government department, and even we're seeing locally with supermarkets, have had to find some way of how to get their business or their services accessible online. Now, Mike, you have many times spoken about how this is important in terms of being able to expand business access, to kind of make things a lot easier to be able to carry out just regular functions that we need to do as citizens of this country. What has the process been like?
Well, you see me smiling because you've heard me on your show many times and other shows speak about the importance for digital transformation.
Yeah.
It's unfortunate that it takes a pandemic to vindicate what we've been saying all along, because it means that Belize had to be dragged literally into the digital age. And I'll tell you, we've responded very well. You know, you look at the portal that we did for COVID relief, which was spun up in literally less than 2 weeks. We were able to capture over 80,000 applications online and process them. As of yesterday, we've actually approved and processed payments for over 40,000. Now, we were one of the first countries to get out the gate with actually getting relief to citizens as quickly as we did. And it was because we decided to take a technology focus rather than trying to figure out how to get that many people that we're telling to stay physically distant to be able to access the relief that they need. So we were able to spin up that application in a very short period of time. It's got a very extensive back-end management system. We're able to spin it up to where applicants are able to go in and search the status of their application in real time, and to be able to receive approvals by text messages. I mean, that has never been done in this country before. So the vindication that we're able to pull this off, of course, it means we did it because we had to. So I'm hoping that same energy will continue even after the crisis has roll out more digital services, not only in government, but also in the private sector. I love seeing the new delivery services that are coming along. There's a lot of talk about new payment systems that are coming along. Those are the things we needed to be doing 5 years ago.
Well, it definitely hasn't been seamless. And I think that one of the things we can clearly say is it happened so rapidly. While the unemployment benefits and that portal was created, it crashed the first day. And so... Well,
it didn't really. It was actually on a test server, and we didn't even announce that it was open, and we got something like 2,000 people jump on there. So it really didn't crash. It was actually not yet launched.
Well, either way, I think my point is that sometimes when we create the technology, we don't know the right measurement as to how many people are going to access at any given time, and the system hasn't been tested sufficiently to know what it can handle. Are these things, and everything is a learning experience in this particular crisis. How do we prevent things like that happening when we move into new technology or launching new technology?
Well, Marlene, ICT, the nature of ICT is that it's always a work in progress.
Yeah.
And Mark will agree with that. I mean, even now, him and I talk every single day about enhancements to this app that we've already put on there for launch, and we're still changing it. Because the reality is that until you take it for a test drive, you don't know what the social reaction will be to it.
Yeah.
And there's things that we imagine people might want that they don't want. There's things that we don't predict the load that's going to go on the system until the load is actually on there. And this has happened just about everywhere. I mean, I have a lot of experience in my past with launching ICT systems, both in private sector and in government, and nothing ever goes as planned. But eventually, the bumps where they work themselves out, and eventually it starts cruising very well until the next crisis. But if you trade that off against what you get with paper systems, the amount of efficiency and the service delivery that you get, minus those minor hiccups, is far outweighs the problems that come with it.
And this seems like a significant initiative, and one that it's pretty impressive that was able to be pulled together in such a short period of time. So I want to talk to Mark a little bit about the process of creating, designing, and actually launching the software from more of a kind of a technical perspective.
Well, so in our end, we were a bit prepared already to have this the infrastructure ready to launch the applications, and that's greatly in part because this year was a census year, but the National Oversight Committee postponed the 2020 census to 2021. So we already had our infrastructure. We had applications that would host about 800 field interviewers simultaneously out per day out. And our infrastructure at the least could hold up to 1,000 persons. We tested it for, as you guys were alluding to, there are some issues that might arise. So in our case, we were prepared to handle at least 1,000 simultaneous connections to applications on our servers. So because we had that already in place, and when the COVID came up, we jumped on it, and we, with the, let's say the guidance from MOH, we developed some applications and a dashboard so they can view the data coming in live from the field mapping exercise. And this is greatly in part because at the SIB, there are 5 full-time programmers, and when it came on, we had a very, a huge sense of urgency, and we had to work literally around the clock, day and night, all of us communicating, chatting with each other almost every day, every night, so until we could get these applications out. And as Mr. Singh said, it's not something that was clear-cut. The original application, what we made for the MOH, went through a series of versions. They have the field mapping interviewer application that's collected on a tablet. They have the emergency operations call center data capture application that's collected on a tablet as well. And these 2 applications went through about 6 iterations each. We initially had the interviewer, the field mapping exercise, collect a ton of information, but then we eventually found out through the MOH that collecting so much information slowed down dramatically the interview process. So at the least, they were saying it takes them about half an hour to collect the information. So that's what the iteration was for. They came back, they told us that, well, perhaps we could remove this. Is there a better way to do this? And it's a series of iteration until I like to say we got it right. And now it's in the sweet spot between being fast and effective in terms of collecting data.
Mark, it's interesting because as you're speaking, I'm thinking of previous conversations with SIB. And there had been so much work already done for the census. And what I'm hearing from you is that a lot of it has been able, thankfully, to be transferred into collecting information, during the COVID-19 crisis. Things like your field mapping, you'd already done that exercise. The software platform for going out and digitally tagging or mapping, mapping the collection of data. This is critical because it really allows us to understand the scope of the information that we now have and how we've been able to get it done so quickly too.
Sorry, Marlene, I wanted to jump in real quick with a quick point. If you look at what some of the developed countries are doing, so we hear the stories about South Korea that's been successful at staying open, Taiwan. What these countries used was data capture and field analysis and contact tracing. So the Western countries are only now just realizing the importance of it, but the problem that they have is that they're jumping through hoops with issues like privacy and being able to build the infrastructure for contact tracing. I think the United States only has, I think I read that they have something like only 2,000 contact tracers in the entire country. The United Kingdom is now starting to test a contact tracing app in one of the small islands with 2,000 residents as a pilot because they realize that the only way they can get to a normal situation until there is a vaccine is to use the technology of contact tracing. Yeah. We were fortunate that as Mark said, we had the ability to deploy 1,000 contact tracers early on. We don't have that many in the field, but we had the ability to do it. We have quite a few. Mark maybe can tell you how many. So we were able to get out very, very early to be able to spread this technology and use it to start bringing in the data that we need to make decisions. And the decisions that you hear being made by the Ministry of Health and the Oversight Committee is coming from the data that's coming from this exercise. Yeah. So people aren't guessing. We know exactly what's going on out there, how the contact tracing, and I hope Mark will get a chance to show you a little bit about the process and the actual software so you can see how this information is being gathered. But I just wanted to make that point that because we were prepared, it actually put us a step ahead of many other countries, which perhaps is one of the reasons why we're able to flatten our curve as quickly as we did. So I'll hand it back over to Mark.
To add to that, another application, the SIP, we had one, in collaboration with the MOH and the PAHO, is the COVID-19 forecasting model. So then we did a series of video chats very early on with PAHO, as they were the ones who, let's say, created this model to predict how many COVID cases to expect based on different scenarios. And of course, as you may imagine, this model is a work in progress. Was a work in progress very early on. And we worked with PAHO. We created the user interface, so it's very easily used by, let's say, a non-programmer, and they can select different scenarios. So for example, they would be able to select that we had 1 imported cases, 2 imported cases, and what to expect if we, under different scenarios, how many people would possibly contract the virus via like close contact and different elements that's part of it. And with the MOH as well, we got their list of resources such as hospital beds, ICU units, and so forth. And using that information, we integrated that into the PAHO model. Yeah. And with the model, now we could see that, based on the information we've collected thus far, we could expect this amount, and equally, we would use this amount of ICU beds, because that's the main important one that we want to see, the critical cases that would actually go to the hospital. And then at which point possibly the health system reaches breaking point. So then by the time we see it reaching that level, they could perhaps enact different services, bring in more beds, or work proactively, or work on as Mr. Singh said, on data-driven decisions.
Yeah, and definitely we've seen that SIB has helped out in putting out the infographics as well. That's also an expertise that you guys had developed.
Yeah, that's correct. We have a data dissemination department there that's have really good designers, if I may say. And they are very good at converting, let's say, statistical data into very easily digested graphics. So in one poster, for example, you could see the information that's relative to what you want to know. And it's, let's say, to put it shortly in layman terms that anyone can see it and readily understand what's going on.
Yeah. Now, I wanna come back to the app and get some of the hows and what type of information we're looking at. So the purpose of the COVID-19 mobile app is that you're able to report if you're feeling sick. Is that the sole purpose?
Well, that was the original purpose. That if you're, let's say, if you're feeling a little ill, then you could log in there. You enter your personal information, primarily contact information, and then we would say why are you reporting. If you're symptomatic of the disease, if you're been in contact with a known case, if you're exposed through your occupation and different sorts of that, and then we collect. If your existing conditions that these conditions that adversely affect you, if you contract the virus, such as diabetes, cardiac disease, hypertension, and so forth, then the questionnaire goes on to collect information of primary symptoms and then secondary symptoms, such as if you have fever, cough, you have vomiting, diarrhea, fatigue. And it finally concludes with travel and contact. So it asks you if you were traveling in the past 14 days, and if you select yes, then you get more fields to fill out, such as which countries, where do you visit, for how long. And then if you were in contact with anybody who's a known case, and finally that you were in contact with anybody who is a laboratory confirmed case. Okay. And all of this information plays into an algorithm. And when you submit it, the system would suggest some information that you should do. And then apart from that, in the dashboard, it also categorizes users or submissions based on what they selected. So then at the MOH level, they can quickly go in and focus on the more severe cases instead of trying to sift through the large amount of data coming in manually.
Okay.
Marlene, maybe he can do a live demo which will actually show this.
Do you have one? Are you going to do it on your phone?
No,
I could share my screen. And
yeah, okay, go ahead and share your screen, and you can talk us through it, because this is user inputted data, which means the person who's using the app will be the one who self-reports what symptoms they're having.
Yes, that's correct.
Okay, let's see it.
Yeah.
Let me go ahead and share my screen there.
All right.
Can you see it?
Yeah.
Yes.
We got it.
Okay, so well, it starts here at the COVID-19.bz site. So then that is the public portal for all information that the government puts out regarding the coronavirus. It has different information for, say, financial assistance and medical assistance. And in there, in the center of it, you see the COVID-19 screening application. So if you click on that, it takes you to the self-reporting form, which is the web version. And if you notice, as you get to it, it tells you, well, it has right there that you can download the Open Health Belize app, which is the name of the self-reporting app. And I'll go through the fields here, and because the fields here are identical to the ones that are listed in the mobile application. So yeah, as I mentioned, that you enter your name, your phone number, and if you notice, these two are required fields because if in case you are marked as severe or a high risk case, then the MOH will contact you so that they can follow up on you and probably send field mapping or data collectors to your house and collect a sample. And then this is what I was saying, that it has your reason for reporting. If you were symptomatic of the disease, if you had other cases, then you could list it there. Your existing conditions, if you have cardiac or disease or chronic kidney disease, if you present any of these primary symptoms, you have a fever, you have sore throat. And once you select anyone, then you get the option here at the field. So you must select the date of onset. Because of the information that we know about the COVID-19 is that it's heavily related to 14 days of contraction. So then we continue to put in other symptoms. We say that in my case right now, I say that it started on the 1st of May. If I had any international travel, if I select yes, then I get to enter different countries and the last visited. Then I would go on to see if I was in contact with anyone on the investigation, so I put don't know. And if I was in contact with someone in a laboratory confirmed case, and if I select yes, then I add some details about the person. And I select no, and then there's a minor agreement here that only lists the purpose of this and to provide some peace of mind to those submitting that the purpose of this is for the MOH to have more information about COVID-19 related information in the community so they can make informed decisions necessary to contain or prevent community spread.
Yeah.
And then it's some other information that the staff members who come in contact with your personal information are very aware that this is sensitive information, and they have been they have been trained in the appropriate use and the protection of your information.
Well,
And
I was going to get there. So this is also the same information that would be captured through the app as well. So there's the website version. You go to a web page, a .com page, and then you can also download the app, and this would be the same type of information you'd input?
Yes, that's correct. So on my screen here, I've listed I've opened the app version. Can you see that?
Yes.
Yeah.
Okay, so the app version, it's composed of two major components now. So we inserted an announcements page, and the announcement page is for persons who have downloaded the app can get instant information from the Ministry of Health or the government. So if they were to say, if we have another case, then they would, in the original press release, they would let it out. And once they let it out, it also would get submitted here. So on my phone, I would get a pop-up notification saying Ministry of Health saying X, Y, and Z and so forth. So it would be like a feed type status here that I would see all the notifications submitted by them.
Okay.
And then here on the next page, we have the self-reporting form, which at the time if you go through it, it is identical to the one on the
web page. Okay.
Symptoms, the headaches, the other symptoms, the information you collect, and so forth. And then note that the information here is strictly for the epidemiology unit, and only they can see or go through this information. And even at their level at the MOH in that department, they have authorization levels that the only persons who need to see it can see it.
I was going to get to that because, gentlemen, as much as people may download apps and freely give information to whatever app they're using, there's always caution when we're talking about something locally, and it's name, phone number, address. Does the app have a geolocator?
Yes, it does actually.
So then it also knows your location, even if you don't report your right address. This is a lot of information that, under the context, we understand why it's necessary, but what's being done for data protection?
Well, as you may imagine, the SIP has significant experience in collecting personal information throughout all the surveys that has been done throughout years. So in that terms, we are very aware on how to protect information. There's a level of scrutiny and data anonymization that happens in the background and in the databases. So but only once it's presented, when you log into your system, then you have the right authorization using your username and password. And it even provides a session key, which adds security. Only then is the information, let's say, available freely to be consumed and not encrypted, so to speak.
Okay.
Marlene, if I can add to that, I know data security and data privacy is of utmost importance, and the two agencies that are controlling this app, as a matter of fact, CETA doesn't even have any access to this. It's only this is an extension of their Belize Health Information System overall. It's not connected to that system directly, but it's the same principles that it operates under. And the principle is that patient data is confidential.
Okay.
So the same data that is collected if you go to KHMH, that is put into BHIS, this is treated exactly the same way. Yeah. And there's no access, there's no access by anyone other than the medical professionals that need to use it. And also the same principles that the doctor operates under when you go visit him or her in his office. It's the same principle that this operates under. So on both sides, you have the Statistical Institute, which is sworn to ensure privacy and security, and you have the Ministry of Health, which is also sworn to the same thing. So I think we're okay on that front.
Okay. Now, and let's talk about what this triggers, because if someone is in a critical situation, maybe they don't realize it as yet, and they do a self-report, how quickly does this information get to the relevant authorities that they can follow up immediately? Is there a system that kind of diverts or prioritizes severe cases?
Yes, let me show you the dashboard.
Okay.
Now on the dashboard, I won't show you any personal information, only the summary view.
Okay.
So then here, because I imagine it's so early, for today, they haven't had any persons under investigations or person under investigations that have been sampled. But we could go around the graphs and show that as the information, this is the dashboard used by the Ministry of Health, and any information submitted via the field or through the web version of the self-reporting, or through the mobile, or through the Emergency Operations Center, which is the call center, any information taken in from there is directly populates the database, and it's immediately shows up here in its appropriate reports. So then by this system, and they can see everything that's happening in the field immediately. And then the system also uses some algorithms in the backend that allows the person viewing it to prioritize the cases. So as I mentioned, based on what you enter, if you had a cough, you have fever, if you travel, if you were in contact, and if you had these existing conditions, all of this plays into an algorithm in the back, and then it categorizes users into high risk, medium risk, low risk, and no risk.
Okay.
So then that allows the health official viewing this to, let's say, prioritize their views at the high risk table, and then once that is complete, then gradually move down to the lesser risk ones.
Right. And is this information updated more or less instantaneously?
Yes, that's correct. So as you submit anything on the self-reporting form or on the mobile app, or if you call in, and once they're talking to you, they're entering it in another application and they submit it, it goes directly into the dashboard.
Okay.
So it's similar to what happens when you make the phone call to the hotline, the 0800 MOH care, right?
Yes.
So it's what the person on the phone would ask and enter into a system, except this time you're doing it for yourself through a web page or through an app.
Yes, that's correct.
Okay.
Yeah, correct. And Marlene, it also, remember, there's 3 different sources of information. One is the web, web/app. The other one is the call center, and the other one is the field agent that's out there collecting on persons of interest. So what that does is that allows us to be able to expand into even additional sources. So for instance, one of the things we're talking about with the Ministry of Tourism is to be able to take a version of the field app to be able to assess visitors, which means that it might help us with visitor management to be able to do assessments either before arrival, because they can download the app while they're in the airport before they get on board to report. When they arrive, we could do a field assessment upon arrival. And as an ongoing basis, when a visitor is in country, we would be able to track and trace where they have been and anybody else they might have been in contact with. So in the event there's a case that comes up, we already have the information to do tracking and tracing to be able to respond. We're also having a discussion with the Ministry of Education to be able to expand contact tracing, for instance, using field a version of the field so that students could be monitored on an ongoing basis by their teacher. So this core software has many applications to help us to effectively manage COVID-19 as the situation unfolds and as we get back to a normal. From all indications, it seems we might be as much as 2 years away from a vaccine. So the normal for us is going to be social distancing. It's going to be continued hand washing, possibly masks, And the big thing is contact tracing that helps the authorities to monitor and manage. So that's what this is all about.
So, I think one of the first questions is looking at who has access. The SIB data from 2019 says that as many as 94% of households have a mobile phone, but internet access is only 58%. So that's a little bit more than half of households based on 2019 data. So, we're catering to one market, but there's still some people who may be left out.
Well, not really, because remember the contact tracers that are in the field are going out to those communities that may not have access. As a matter of fact, Mark will tell you that the software actually works offline with the contact tracers.
So you don't need, if I get internet access to download it, I can input the data with no internet access.
Well, I'm not sure about the mobile app, Mark. Maybe you can answer that.
Yeah, that one that works offline is for the interviewers or the field mappers that go out and take the sample.
Okay.
And that is, as you mentioned, because not many, let's say there are locations here in the country that do not have readily internet service.
Mm-hmm.
So in that case, once they are on the field, if they come and visit my house, they can enter the information, they visit my neighbor, they visit somewhere else, and then once they are ready or they go to somewhere with Wi-Fi or somewhere with data, then they can sync the information, and information that is stored from the interviews in the tablet gets removed from the tablet and it gets placed in the server. And this was coded this way because, as you said, tablets are, let's say that the tablets are SIM-based, so then they do have data. But if they are on the field, there may be some patchy locations that may not have internet service readily available. So then that's not going to stop anyone from collecting information. And they collect as much as they want. And once they are in a service location and with data, or they connect to a Wi-Fi, then they can.
Then the internet is uploaded. I mean, the information is uploaded.
Yes, that's correct.
Oh.
Yeah. So what that means is that a community health officer can take up the slack for people that don't have connectivity on their mobile device. So we can get as wide a coverage as we can. It will never be 100%, but the larger our sample is, the more accurately we can respond. So yeah, we'll never get 100%, but I mean, I don't think any country will ever get to that point, and I don't think this need requires 100% coverage.
So moving forward, are there thoughts or plans as the expansion as to what this app may be able to do? We hear stories when you talk of technology, especially in Korea, but I don't know if we'll get there, when you talk about tracking and those types of options.
There's a bunch of new technology that's coming out. Singapore, for instance, came out with a technology that allows for proximity tracking between cell phones using Bluetooth technology. They're having some problems with it. Actually, they've actually given us the open source. Mark has the open source to be able to deploy that identical application. But again, the shortfalls of that is that all devices are different. Google and Facebook and Apple have collaborated to put together in their new operating system enhancements that will actually allow that same functionality that we would be able to tap into using open source as well. Whether we'll get to that or not is something we have to discuss, because when you talk about privacy issues, then you're getting into some real murky waters at that point.
Oh, absolutely. That's why I'm asking if there's any plan as to what, I mean, is this the sole aim right now, or are you looking to use it for future use? That's the question.
There's always opportunity for bringing in new ideas. The fortunate thing is that we do have a base to build on, where we can tap on. Again, that would just be another source of data for us. So we can add as many sources of data to feed into this one common database as we need to. What I like about the Statistical Institute's involvement is that the statisticians there understand how to interpret data and how to use data. So the more data we get in, and I had a conversation with Dr. Manzanera yesterday, that you can never have too much data. You decide which data you want to use, but as long as we're gathering it, we can then be able to convert that into models to help us to predict what will happen next. Now, thinking much further in the future, COVID-19 will not be the only pandemic. We may have more flus and certain things, and we have to be prepared for it. So being able to assess the public health in a manner that we're capturing data on an ongoing basis, this app might be useful for us to look at other diseases as well, to be able to do mapping. No, it was tried before under Zika to do an app, but Zika was not the rock star that COVID-19 is. So the opportunity that COVID-19 gives us is that everybody's paying attention.
Yeah.
All the top shows are asking us to come on and show this. Under Zika, I don't think anybody paid any mind to it because it was not seen as a clear and present danger as we have today. It's not impacting the economy of people like it is today. So we have the opportunity to be able to build something that can serve us moving forward to look at public health in general.
Yeah, if I may add to that, I've spoken also with the health officials, and they actually do like the host of apps very, very much. Yeah. And they also commented that or inquired if this application would be able to, let's say, modify slightly or generalize, such as if they have another outbreak of any disease, if they could use the systems in place to track that, such as pink eye or malaria or anything that spreads through contact. Yeah. Then they also are looking into the future of saying modernizing the way they collect data so they could be, in essence, make better decisions and contain it.
Yeah, and definitely, I think knowing hotspots, as they call them, is always helpful. So it could be the silver lining, having the technology now introduced into the healthcare system. Let me just ask, the app is only available in the Android store, right?
Currently, yes. We're actually going through the process of the app has been submitted to the Google Play Store and the Apple Store. However, that process may take a slight time for approval, but once that is up, then we'll paste the link there, so then find us on the App Store or find us on Google or Apple Store, and then you click on it and you can download it on whichever platform you're using.
So just to be clear, because people are more accustomed to going to the App Store or Google Play, that's not where you're going to find this app. You have to go to the website and download the application package.
No, well, currently it is only available on this website, yes. Yeah. But we do plan, or we have submitted it to the Google and Apple stores. Yeah. But then that may take a little while approval. So then once that is over, then they can go to the stores to download too.
Excellent.
Yeah, Marlene, for now though, the web version operates exactly like the app.
Yeah.
So it's for small screens. So it makes it, like for instance, I have an Apple phone and I am able to go in and log into covid19.bz, click on the link, and it's just like I'm in the app. Yeah. So it doesn't make much difference.
And the information submitted is the same.
Exactly.
All right. Yeah. So it's now available. People can go on today and be able to input the information. Now, naturally, some of us may just want to go on and input it even though we feel okay. Is that also accommodated for in the data collection?
Yes, that's actually part of the discussion that Mr. Singh said that we were having yesterday, that same exact thing. So then the suggestion to that is that reason for your importing, or you have any existing condition, then there is an option now that you can select none of the above. Mm-hmm. And if you select none of the above, means that you are actually feeling okay, you just go on. But then as for us, it's good, as Mr. Singh said, as long as we're collecting data, we want more data so we could do better analysis. And for them, it's good that they could submit and feel that they're doing.
Yeah, it's important to know that your population is well, as well as it is important to know that the persons that are not well. Mm-hmm. So it gives you a frame of reference. Now that information on the people that are well will just be archived, because there's no need to hand that over to the EPI unit for them to react. But it's good to know that you have 99% of your population doesn't have any of these symptoms. That's a good statistic to have.
Okay. All right. So once again, let's hear that website. Where do people go if they want to self-report on any possible symptoms?
You could find it on covid19.bz.
All right. Well,
And
great
if
job.
it-
And, you know, we wish you the best of luck. It makes things just a little bit easier for people to be able to share their information or get more information. So thank you for joining us and
very
telling
much.
us all about it.
Thanks, Marlene. Thanks for having us.
All right. Stay safe.
All right. Have a good day.
You too. And there you have it. That was Mark Noble from SIB and Mike Singh, an advisor for e-government. And they're talking about the COVID-19 mobile app. So once again, if you want to go and download the app, you can do so from the website, the COVID-19 website. It's covid19.bz. And you can do the screening right on that webpage, or you can download it from that webpage itself.
Yep.
All right, we're going to go ahead and take a break. And when we come back, there are lots of changes happening, even within the workplace. So we're going to get some advice about how to manage change within your business. That's coming up after the break.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Technology is ubiquitous.
And we're back, and we're moving into our second conversation for today. And here's the thing, we talk about this new normal. Well, it's not quite normal yet. We're all going through this collective change process together in our homes, in the public, and also in our workplaces. So today, we're having a conversation about change management within the workplace. And here to kind of give us some tips on what we can do, we have Charlene Neal Lopez, who is the Managing Director for the Belize Institute for Service Excellence, Leadership, and Research. Good morning.
Good morning.
Hi, good morning, Marlene. Good morning, Gavin. Good morning, Belize. Greetings from warm and sunny Belmopan. It's Charlene Neal Lopez.
Oh, I'm sorry.
Yeah.
Yes, I'm
everybody
just,
confuse us.
Yeah.
We're identical twins, so that's acceptable. I kind of used to it by now. Yeah.
you know,
I
we
spent
should
half
just,
of my life,
we should call you and your
defending
twin
my
share. That way we'll be safe the entire time. But thank you, Charlotte.
Charlene.
But let's talk about, so you offer training for workplaces for many different aspects. And
Yeah.
this is perhaps one of the times that there's a lot of information that we need to help us cope.
Yeah, well, the Belize Institute for Service Excellence, Leadership, and Research is a young startup company. And so naturally, when the COVID crisis hit, it puts us in a little bit of a limbo. Our goal really is, our vision is inspired people who are serving with passion and excellence. We want to empower the workforce, and we want to see people serve to their full capacity. So we engage, we equip, and we inspire. That's what we primarily do. And we are also a business development consultant. We offer that service as well.
Yeah.
So that's what we've been up to.
Okay. Now, Charlotte, let's just get into this topic, and I'm very serious. There's a whole lot of change happening all at once.
There is so much change indeed. In fact, at our organization, we have had to make some of those changes. And the reason why I'm excited about talking about change management is because what I want to emphasize more than ever today is that change is a process. One, change occurs at different levels for different people at different speed. And so I really want to zoom in on that when we speak directly to the managers, you know, to work with your people to ensure that they, you know, you get them up to that speed and don't assume that everybody is aware that it's time to change. Here at the Institute, what we have done is starting moving our services online. And so we're excited about the platform we're creating to be able to offer trainings online. And we want to go from just interaction over maybe a Zoom or a webinar to actually having a platform where you can go in and do your coursework. So we're modeling it off things like Coursera and Udemy.
Yeah.
And I'm very, very excited about the prospect of being able to do this. And even though we're not fully launched as yet, we decided to just test the waters and go right in.
Yeah.
And so right now we're actually offering an emotional intelligence course, which we think is a very relevant topic.
Nice.
And you know, we're making it so affordable. But our goal is affordable and quality online training.
Okay.
And so that course right now you can register for, but it's a part of having grasped that change.
Yeah.
But we won't stand here and say that from day one we got on the donkey and we started riding it. No.
Like all the rest of us, we just hit the ground running, like in a sprint, really.
Exactly. It was not that case.
Yeah.
We had weeks of sitting back and just anxiety, worried, you know, even fear that our organization would not make it through this, right? And so that is why we want to talk to the public about change management.
All right. Well, let's get into it, because I think it's so much important information. Where do you start? I mean, the leaders themselves have to acknowledge and accept the change.
Yes. Well, first of all, understanding that change is disruptive. Change is disruptive. That's the first thing. I mean, think about the fact that you're heading in a particular direction, the direction you've known for a long time. And all of a sudden, it's like there's a roadblock. You know, what happens then? What's your first thought? How do you deal with that block?
Yeah.
And so what COVID-19 has been for many individuals and organizations is that block. And the fact that you're not able to say to people, well, deal with it, you know, the response will be different. The people who are going to, and the organizations that are going to adjust and bounce back are those who are easily, who adopt easy to change.
That's right.
And when I say that, it means that you can't just now start thinking about change. And so
It also means that there has to be a level of flexibility built in. And you know, that's such a huge difference.
Exactly, it is. But I will say this much to those who might already see that they're having a head start.
Yeah.
Build change into your everyday existence is my first tip or advice. You see, there are certain people who are fixed in their ways. They've always done things this way. This is the one best way. And it's really the only way they know. Like, we've been living on autopilot, so to speak. And so it makes it so hard for you now to adjust because change is not a part of what you do.
And it can be scary.
It can be scary. And that's why I'm very excited to see what will come out for entrepreneurs. Because by nature, entrepreneurs exist on change. Their organization should be flexible because that's what they do. So that's what I encourage people to do. Build change into your routine. Don't get stuck in your ways. And these are basic tips when it comes to building change in your everyday routine, your personal and your professional life.
Yeah. And I appreciate, you know, one of the things that is very clear, you called it disruptive, and you know, that's perhaps the best description that there is, because you just couldn't plan for it. And I think what a lot of companies may be grappling with is that they had a yearly projection, they had schedules, they had, you know, a list of things that had to be done by first quarter. You know, this was in the middle of the budget year transition as well, the financial year transition. So there are all these things that are taking place, and there is still a great deal of uncertainty ahead. So changing, while things are still changing, it's compounded.
It is a fact. So that's one of the first part of where to start.
Okay.
For us, this was what happened when COVID-19 hit. I mean, you look at your Google Calendar, right? Because everybody uses that, and then it keeps telling you, okay, this is what you would have been doing today, or this is, you know, the trading, or this is the deadline for ABC, and all of that is irrelevant because you know, those deadlines and those events are not practical anymore. So it places you in a position of uncertainty, anxiety, and all that brings. And then you're now dealing with other people. So as organization leaders, you start thinking not only of yourself, but your people. But I think our approach the first 2 or so weeks to just stop and get in the mode of survival rather than worrying about your organization at that time, because I think Belize was maybe preparing for the worst while expecting the best. Yeah. And so those 2 weeks, the fact that maybe you didn't get anything accomplished or very little accomplished, you shouldn't beat yourself up over that.
Yeah.
You know, like you know, some of us became chefs, gardeners, cleaners, because we just needed something to fill that space. where
Yeah.
we were normally so busy. And so don't beat yourself up, but you can't still be there. Yes, you still have to go water your plants if you started the garden.
Yeah.
You can't still be there. This is now the time when you need to be moving away from shock and survival mode to re-strategizing and looking at what your response will be if your organization is to survive this crisis.
Okay.
And so what we look at is several things. We have a model.
Yeah.
But before we get into that, we look at patterns and routines.
Yes.
And we say patterns are good and they're bad. Routines are good and they're bad.
Yeah.
Now, they are good because they offer stability.
Yeah.
They offer a path. Now, they are bad in times like these because you're not able to quickly adjust. When you follow routines, it's what your brain is used to. Your brain realizes patterns. It adjusts to patterns. Imagine if every single thing you do, you had to think about it. My gosh, that would be so taxing on the brain,
Exhausting,
right?
yeah.
Exhausting. You have to tie your lace. So,
Yeah.
okay, how do I do this again? It's like you're learning. So patterns and routines and learned behavior is what gets us through. And so they are important. They are very important.
Yeah.
Now, where they are bad is because you tend to not know any other way of doing something.
And you get thrown off course when it doesn't go that way.
Exactly. I ask people, when last did you enter and exit through your back door on your way out? Back door. You know, it's like changing up your routines.
Yeah.
Helps you to adjust your way to work. Do you take different routes to work? All of these things will help you when trouble comes and change is needed, you know, because there are parts of your brains that you know, it's like, wow. I see people sending around these little stuff that I hate, these little puzzles, one and one, and then they show two duck. I was like, that's two duck, all right? And I don't like them, but it's helpful at this time because it's engaged in your brain.
Yeah.
To think in new ways.
Yes, I never get them. Trust me.
But you try. That's good. So I like that. So, you know, in moving forward, we want to think of new actions we can introduce that keeps our mind ready for change.
That's the goal.
Okay.
That's the goal. Okay, so what we use is the ADKAR model, ADKAR, right? It's a model to manage change in a systematic way and to recognize what's going on at all levels and across different personalities. The first one in ADKAR, the A stands for awareness, all right? And so by now, we should have been, you know, somewhere there. You are aware of what's going on, and you are aware that there is a need to change.
Yes.
So most organizations could probably be there, or individuals. Okay.
Of course, if you've been out of work for a month, you know there's been a change. You're aware.
People are calling it the new normal. And I tried to come up with another word, but I couldn't find one because I thought it was like, okay, there has to be an... So the new normal, let's call it the new normal. You are aware that things are different. There are changes that needs to be made. So how are organizations dealing with this, or how should they dealing with this? At this time, a lot of communication should be taking place. Communication is key during this time. Communicating with your people, finding out how they're feeling, finding out how they're being impacted, and just communicating, you know, letting them know that you are concerned, issues like that, right?
You know, this is interesting because I think that one of the things that you know, you talk about communication and concerns from employees. Job stability is number one, I think, across the board. So if if the business was closed for a month and I wasn't working, and we come back, and whatever it is that, you know, if it's reduced hours, if it's reduced pay, or if it's just, you know, cutting down overtime, the employees are just thinking to themselves, well, what will happen next? Am I going to lose my job? Should leaders have that conversation, even though it's still uncertain, with their staff?
They need to have that conversation with their staff. And to be honest, a lot of employees are ready to embrace, you know, loyalty to your organization is a huge thing. And a lot of employees are loyal. Yes, they still have those who are working for their pay, but they are loyal to the organization. One. Two, they recognize job isn't as easy to find. So half a loaf is better than none. And so when you speak to your people in an honest manner, where they feel that, you know, okay, we can work this out together, we're not making any promises, but we're talking this through, and we're seeing how we can help you. And if it means that we're asking you to cut back, then we're cutting back as well. If we're able to assist, then we can assist, you know? So there's a lot that has to go on there, but communication has to be. In a time of uncertainty like this, when you're still, you know, you need to retain your people, you want to be talking to them. Having those open and honest conversations. But again, if that was not a part of your organizational culture, then that's another change that you have to address.
Yeah, and I think
I'll start doing that.
It also occurs to me as you're talking in that if you are in that sort of management or employer position, you know, that communication is extremely important, and you need to get sort of the feedback from the persons within your organization to take them into account primarily when you're making your changes.
Exactly. In fact, communication should have started from the get-go. By now, employees are already deciding, you know what, this is probably not even the place I should be. I'm going to leave as soon as I can. Or you know what, this is the organization I want to stick it out with. Because from day one, I recognize that my best interest, this organization had at heart. You know, and I've seen it from some of the posts and the discussions is like, my people don't, you know, they don't care about us. You know, so how do you determine that? And it's not financial, really. It's keeping in touch. It's engaging your people. It's saying, hey, I need to know you're okay. You know, we're here for you. You know, your actions and your words line up at this time.
And it's interesting because, and Charlotte, we've talked about this many times. There's a change in terms of how business culture is. And I think the antiquated system is the leader who puts off the facade of strength, the pretend strength. And the truth is, most employers are probably experiencing a lot of different emotions themselves. Like, they don't know what's going to happen, but they feel that they shouldn't communicate that to staff. But in fact, what we find is that employees these days, it actually has the opposite reaction. If you're not open, it makes you completely unwilling and resistant.
Exactly. Be open with your people is what I have to say. Right now, employees understand that this has nothing to do with you. That this is something that is affecting all of us. You did not create this scenario. But don't be, you know, eating steak, for want of a better analogy, and feeding your people ramen. It's basically, you know, saying we are all in this together. The playing field is limited, it is level, and if we're struggling together, you know, if we're struggling together. What is it that we can do as a team, right? So the awareness is one, and if you've passed that stage, lovely, then you can move on to desire. That's the D in ADKAR. The desire to participate and support the change. And we touch a little on that in awareness.
But this is desire from which end?
Desire from your employees' end. the desire from your employees' end. They desire to participate and to support the changes that are needed in order for you to move on.
Yeah.
I know of an employee who actually approached the employer and say, hey, you know, I'm willing to take a pay cut so that you don't send home John. You know, and that was very normal. And I've seen that coming out from employees saying,
people
hey,
who are willing to take on more work, people who are willing to work for, you know, at a reduced cost.
Reduced cost.
So sometimes it does work. Sometimes the employees do see and want to help. That desire is there. But let's talk about the ones who don't, the ones who are so stuck in how it used to be. And you know, I mean, I get it. We all want to go back to what it was before, but it also leads to a general level of pessimism.
Yes, definitely. You see, you will find that those behaviors did not just start. Those are behaviors that were there before, that you probably need to have been managing, and you weren't, or you ignored because it was convenient at the time. It wasn't an issue. But at this time, teamwork is essential. Collaboration is essential. And so what you want to do as a leader right now is not pretend you have all the answers. It's not a situation of tell all, know all. It's collaboration. And so it's bringing in those people. And so one of the things you also want to do, instead of having a conversation that says, you know, we have to cut, you know, or we have to let go, okay, let's talk. What do you see happening? What do you see? What are some of the options that are available to us as an organization? So you're putting some ownership in your people, and you're not just saying, well, I'm not the boss, you know, and I make the decisions. You see, it makes it so much easier. You will find that maybe there are people who decide, you know what, I better start easing my way out of here because it doesn't look pretty for me. And so you don't have to let them go. They're looking at other options that are probably available to them at this time, right?
And this is where you speak of, so in building the desire, I mean, they're all linked. So the awareness comes with communication, desire comes with open communication, and then the knowledge is your next step, which also talks about just having people contribute. And it goes back to the same thing. If you contribute, you feel like you have a piece of the pie.
Feel like you have a piece of the pie. Knowledge, right now in a disruptive situation like this, the knowledge, you use your people to build that knowledge. Maybe there are people in your IT department, right, who are very tech savvy. Others are struggling and lagging behind. So you want to use those people to build the knowledge. You want to also identify what are the new skill sets that people will need in order to make the adjustments. And you want to source those skill sets, those trainings for your people. You want to, you want equipment. You can't say, well, you know, you don't know that. Okay, well, you know what? We might not need you anymore. We need people who know how to, you know, Skype and how to Zoom in and how equip your people with the necessary skills, retool them so that they are equipped. You know, knowledge, you have that hub, have that collaboration, and you will be surprised at what is available among your people. This is a time when resources are scarce to build on that loyalty and that collaboration. There are times when people, if they feel they're involved and they're relied upon and they stay for different reasons besides the increases. They stay because they feel they're building something together as a team. So that collective knowledge and, you know, so that is what you need to do right now.
And you know, what also occurs to me as you're saying this is that, well, two things. One, in that there's a lot of benefits to be gained from getting a lot knowledge from a lot of different perspectives, because everybody has their own strengths and everybody has something to offer. But the other thing that I'm also, and it's very much related, is the importance of being open-minded and welcoming to getting new knowledge, because especially in a situation like this, you need ways to adapt, and the technology is a great example.
Yeah.
A lot of people especially if they've been in business or been doing something for a very long time, they think, okay, well, I know this way has been working for the past 10, 20 years, why should I change? Or, you know, how can I change? So you have to be open-minded, receptive to getting knowledge from what's happening and from other people.
You must. And the thing is, like your first guest said, these are things we should have been doing.
Yeah.
We should have been doing. We should have had our strategies aligned, looking at, you know, platforms for moving. And so those organizations who had those online mechanisms are already moving forward and offering those services, you know, in some way or the other. But if you did not have that, that's fine. It's a good place to start looking at how can I even diversify? Because one of the things you want to look at right now as an organization is what are the needs of people? Because people are not looking at luxury again. I think the fact that we've been told from the day we were born that you should save at least, 3 months of your salary in terms of a rainy day has now become a reality. And so people are now more cautious. They're looking less at luxury and more at needs. Yeah. So what is it that people need? Yeah. You know, as one of your strategies when you're looking at your organization and moving forward.
I think that's such a critical point. I thought of that the other day. You know, sometimes you plan or you're going through this transition and you're trying to assume the changes that everyone is experiencing. And, you know, Gavin said it best. It may have worked perfectly for 25 years, but nothing is working the way it used to. So even if it's like frontline staff, you can't assume what their challenges are. Or someone who is, you know, working night shift, you can't assume what their challenges are. It goes a long way to just ask about how to make it a bit easier.
How to make it a bit easier. And that is why even in our organization here at the Institute, we are very selective about the courses that we're putting out there. I mean, one of our forte is customer service. It's like nobody wants to be hearing about customer service unless it's talking about how do I gain these customers. But for example, in the tourist industry, there's none. Yeah. So we can't be talking about that. Yeah. So we have to adjust. And so whatever our courses are, it has to be that those are speaking to the needs of the people. Yeah. And so things like emotional intelligence, crisis management, you know, change management, we have to look at the themes that are relevant, unless we would be launching our nice fancy courses and nobody would be, you know, able to access them because they can't relate. It's not their needs. And so that's the goal for companies at this time. And so that's the reason why you need to brainstorm with your people when you're talking about knowledge. And it could be an exciting time. Trust me, it could be an exciting time.
And everybody has something to contribute.
Everybody has something to contribute. Yeah. And that is something we've been pushing as an organization for the longest, to get companies to understand the need to get your people involved, to pull in your front line from time to time and say, hey, what are customers saying? What are people, you know, looking for? You know, what do they ask? And if we've been able to do that from the get-go, right now, it wouldn't be difficult. But it's not too late. It's not too late to engage your people and to start from the ground up to build the knowledge you need and the resilience that they need to move upward.
So the next step is actually ability, because even in that assessment or discussion or openness that you have, you may just realize that people need new skills.
They need new skills. They need new skills. And so the ability to implement the required skills and behavior, right? So this is the point where you talk about those negative people. There will come a point when you will have to pull people aside. You've been trying, you've been working, you're trying to make it fit. It's a stressful time for everybody. It's a challenging time. You need everybody on the team. Mm-hmm. And so you will be needing to pull people aside who are at this stage still not, and saying, okay, how is this going to work out? Because clearly you see what we're trying to do here, and it's not, is there a problem? And you have to address that one-on-one. And so retooling your people, like I said, providing the skill sets, that's what's going to be necessary at this time.
Yeah. And lastly, you talk about reinforcement. Reinforcement.
Don't assume that now that we've retooled, we've come up with new strategies, we're working it. You need to constantly go back and make sure that it's working for you and your people. There has to be constant reinforcement, meaning you have to be looking at new trainings, you have to be reevaluating those meetings I talked about earlier. Communicating has to become a way of life for your people. Training has to become a way of life for your people. Constantly testing the waters to see what's out there has to become a way of life for your people. And most definitely, empathy and understanding what the struggles are that individuals in your organization are going through.
Yeah.
For them, it's a lot. Some of them have families. They have kids who are no longer in school.
Yeah.
So besides the fact now that we have pay cuts and other challenges, there is a need for a daycare when there was none before.
Yeah.
So there's additional expenses. So the struggle is real for many. And so organizations right now who are more socially conscious and socially aware are those that would, I think, survive during these times, these challenging times.
All right, that was a whole lot to take in such a little time, but so much useful information. I think if people just kind of open their minds to these strategies and find a way to work along with their team, they may be able to, and we've seen it, because we've seen some really innovative practices kind of just pop up, and I'm sure that those are the companies that are they're just kind of getting everyone together and trying to figure out a way forward together.
Exactly. And so finally, Marlene, understanding, and I had sent a slide with this, that everybody adjusts and adopt at a different pace is very, very important at this time. So people who might have been ahead and excelling in the organization is suddenly finding themselves struggling with certain concepts and tools, and so understanding that people will pace at a different level and ensuring that those who get it are there to support others is very important during this time. We shouldn't be evaluating people and looking at, how you're doing. They adopt at a different level.
It's not a punitive time. It's a supportive time.
It's a supportive time. And finally, understanding that management is not a one-size-fits-all. Working one-on-one with your people right now is one of the most important things you can do, right? And stay the course. Things will get better eventually.
That's right. Well, we appreciate you sharing all this information with us. And also, you do have that online emotional intelligence class for $20. It's four sessions.
It's 3 sessions. It's $25 if you register by the 21st of May. It's $20. And it's a very relevant course. It's along some of the lines we've been thinking. It looks at self-awareness, and it looks at social awareness as well as management. You look at those triggers, the things that trigger you. How do you deal with them? How do you develop empathy and understanding that how your behavior impact others in the workplace and in your personal life? And that's very important at this time. The flyer, you can access our Facebook page, the Belize Institute for Service Excellence, Leadership and Research, or you can contact 621-734 to register for this online course.
All right. Thank you so much, Charlotte.
It's a pleasure as always.
All right. Stay safe and thank you.
My pleasure.
All right. We're going to go ahead and take a break now, and when we come back, we are going to be doing some gifts
crafts,
for
yeah.
mom.
Yeah.
Yeah, I know. I haven't done that since I was a kid. Used to make the arts for your mom when they were a kid.
Yeah,
But
me too.
we're going to show you how to do it at home. And we're going to be under the guidance of the stationery house. And we'll show you exactly how you can make that perfect gift for mom. That's coming up after the break.